Thanks everybody for coming to today's CoLab presentation. Today's an exciting time because we're actually going to be talking about some of the work that CoLab has been doing for the last couple years, specifically on the equity-oriented monitoring framework, which I know sounds not exciting, but it actually is very exciting. We've got two of our team members here, Karen and Thea. I'm going to pass it on to them to do their individual intros. Thanks, everybody.
Thanks so much, Brittany. I'm Thea van Roode. I'm a research associate with the CoLab project, and I'm going to be presenting today with Karen Urbanoski. We're going to be talking, as Brittany said, about the development of an equity-oriented monitoring framework for substance use and health. Next, please. So this research took place on the traditional unceded occupied lands of the more than 200 First Nations in what is now known as BC. I'm calling in today from the traditional territories of the Lekwungen-speaking peoples and the Songhees, Esquimalt, Lusanic First Nations. We acknowledge and grieve the disproportionate impact of the toxic drug supply crisis on First Nations, Inuit, and Métis people, which is a direct result of historical and ongoing impacts of colonialism and racism. Next, please. So as we're heading into the 8th year of a public health emergency, we want to honor and dedicate this work to team members, family, and friends who've been lost to the toxic drug supply. Next, please. So I'm going to tell you a little bit about the project, and then we're going to get into the equity-oriented monitoring framework. So CoLab is the collaborative community laboratory on substance use and harm reduction. It's led by Dr. Bernie Polly and Dr. Karen Urbanoski, who are here with us today, and it's supported by a wide number of other researchers and groups, including the Alcohol and Other Drug Monitoring Group. Next, please. So what is CoLab? CoLab is really a network for research and knowledge exchange, and our primary aim is to promote health equity for people with lived and living experience of both licit and illicit substance use. And one of the ways we're trying to do this is by generating practical and actionable evidence for communities. So we want to help improve substance use services and promote healthier public policies. We do community-based research. So we're looking for collaborative projects with people with lived and living experience of substance use, families, community groups, service providers, researchers, and policymakers. So this community of practice that you're participating in today is one of the ways we've really tried to build capacity for this and develop a network for research and knowledge exchange. And in order to help generate practical and actionable evidence for communities, we developed a monitoring framework for substance use and health, which is an equity-oriented monitoring framework. Next, please. So first, to start off, what is monitoring and what is equity-oriented monitoring? Well, monitoring and surveillance is a core function of public health. It's collecting public health data and then tracking trends in that public health data over time in order to inform policy and practices. So routinely collected public health data often includes things like individual behaviors. So you might collect data around how much people are drinking and on health outcomes. So for example, on hospitalizations or deaths related to alcohol use. So equity-oriented monitoring is trying to extend this routinely collected public health data by understanding where inequities might exist in health outcomes and how policies might impact some people differently than others. We're trying to also collect information around conditions for health that we know that are really important. So we might want to monitor structural determinants of health, like policies, so government laws or regulations or bylaws, as well as social determinants of health, like services, like what services a person might have access to within their communities, and whether this might be different if you live in an urban area compared to a rural or remote area. So we know these conditions for health are really important, and also that they can be modified to support improvements in population health and to reduce inequities. One of the really central principles of equity-oriented monitoring is inclusion of people with lived and living experience. Next, please. So why do we need equity-oriented monitoring of substance use and health? Well, as we said, we know conditions for health, like policies and services, impact substance use and impact health outcomes. There's a lot of evidence that policies promoting alcohol availability and marketing, for example, worsen population health, and that criminalization of other drugs contributes to health inequities. The public health emergency associated with the toxic drug supply requires evidence. So we need data to inform policy and practice and to track our progress in supporting health equity, to see if we're improving population health and reducing inequities. There's also been a lot of changes in the context that can influence substance use and health. These can be things like changes in drug policies. So decriminalization and cannabis legalization are going to impact substance use and health. And other changes in our context, like the COVID-19, climate change, or anti-trans policies, also impact substance use and health. So when we're thinking about equity-oriented monitoring, there's a lot of really great work that's being done to start to try to monitor these types of factors that are important. And there's good efforts within BC and Canada and internationally. And what we really set out to do was to create a unifying framework that starts to map all these different factors that we know can be important to substance use and health, and that can potentially be modified to support improved population health and reduce inequities. And those existing monitoring efforts, they would fit within the framework, and we can start to see, where is the work happening in monitoring? What measurements do we have that we can use? What data is available, and where are the gaps? And this can help lead monitoring efforts. So for our development of the framework, we weren't really looking to develop the specific measurements or indicators, as they're called. There are hundreds of those that could fit. What we're really looking to do is to map out the factors that are important to substance use and health and the interrelationships between them. Next, please. So how did we go about developing the framework? Well, the first thing that we did was we reviewed the literature, and we looked at other frameworks on health equity and substance use and monitoring of health equity and monitoring of substance use. And through that review process, we selected the WHO Commission on the Social Determinants of Health framework as a starting point. And that's because that's already quite a comprehensive framework in thinking about what can influence health outcomes. And it has an equity perspective, and it's got a strong theoretical foundation. So we took that framework as a starting place, and we adapted it to be specific to substance use, and also to bring in critical theoretical perspectives around health equity and findings from our other work where we looked at health equity in health systems. So this gave us a preliminary framework that was a starting point for community engagement sessions that we did to solicit feedback. So our next step was to hold focus group with a wide variety of stakeholders to review the framework. We had 12 semi-structured focus groups with 49 participants. And we included people with lived and living experience of substance use, families, service providers, policymakers, and researchers. And this is really, we considered this part of the equity-oriented process to have inclusion and representation in the development of the framework. So after we finished that process, we integrated the findings based on the feedback that we heard and created a framework that we're going to share with you today. Next, please. So sorry. We heard a lot of feedback from the focus groups, and there may have been some of you who participated in that. We'd like to thank you for your participation. We heard a lot about where there were gaps, how we could improve our framework and our definitions, and we heard some larger themes around what we needed to focus on. So I'll tell you a little bit about what we heard, and this is definitely not a comprehensive list. We heard the importance of drug laws and policies and focusing on impacts of criminalization and decriminalization. We heard that stigma affects all elements of the framework and really needs to be threaded throughout it. Participants emphasized engagement of people with lived and living experience in policy development and service planning, and how you can start to measure whether those processes are in place and accountability mechanisms for that. And we heard that policies like child welfare, family policing, housing, and income assistance that aren't directly about substance use are really critical. And that how services are delivered is as important as what is delivered, and that there may be discriminatory practices and services. And finally, we also heard that we really need to consider potential benefits of substance use as well as the harms. So I'm going to hand it over to Kara now, who can walk you through the framework, and she'll talk a little bit more about what we heard from the focus groups as she goes. Thank you very much.
Thanks, Thea. It was a great introduction. I'm Karen Urbanoski. I'm one of the leads of CoLab, and I'm going to walk through the framework. So as Thea noted, this is meant to be a unifying framework for all of the reading and the discussions and the focus group data and the evidence that we were able to gather over the past couple of years. And we've incorporated all of that into what we see as this, what we're proposing here today as a unifying framework for the topics, the concepts, the ideas that you would need to look at if we really wanted to apply monitoring activities, which we do already as a society, towards improving health equity among folks who use drugs. And so this is our equity-oriented monitoring framework for substance use and health. It's a bit complicated, granted. There's lots of arrows and boxes on this slide, but there's 4 main parts that I'm going to go through today. There are the structural determinants of health, some intermediary factors. The intermediary factors directly influence health outcomes, whereas the structural determinants over here on the left are considered to be indirect influences on health outcomes. And so we'll go through each of these 3 components of the framework in turn. And then finally, these 3 components are influenced by these social and political processes. And that's where we'll start. Once the presentation is done, I would encourage you to check out our interactive model that is on the CoLab website, and to get in touch if you have any comments or questions about what you see there. Okay, so we'll start with the social and political processes, these arrows that envelop the framework overall. One of the key contributions of the prior work, so the literature review that we did, and when we were drawing from our prior work, including a project called the Equity Lens in Public Health, which was led by Dr. Bernie Pauly, who is also here today. One of the key things that we learned was that it's important to incorporate not just structural determinants of health, but arrows that represent social and political processes. These thread across the components all the way from contextual or structural influences on people's health down to outcomes. They're processes that emerge from the context in which people live to both promote equity as well as to increase inequities. So they have both positive and negative influences. At the top of the diagram, you have examples of processes that promote health equity. So this includes representation and inclusion of people who have lived and living experience of substance use in all elements of the framework. So this is about engagement and inclusion. On the contrary, social and political processes that act to increase health inequities include factors such as stigmatization, colonization, criminalization, racism, gender discrimination, homophobia, transphobia, ableism. These are often what we call our isms that act as processes. They're not just factors that determine an outcome, they spark a process, which then unfolds over time and leads to a health outcome. So we wanted to represent that dynamism with these arrows. One thing that we heard in our focus group, this is a quote from one of the participants in the focus group that speaks to these social and political processes. If there is a measure of representation or community involvement and decision-making, so that would be a good way of monitoring. What do people in power look like? Are any of them people who have used drugs, who use drugs now, or are connected in any way to the community? The next component of the framework is the social and political context. So this is the context in which people live. It shapes the distribution of resources across society. This includes factors like how governance is done, big macroeconomic policies that determine things like whether there's funding for needed services, what the economy is like at any given time, as well as social policies, other public policies, laws and policies that determine the marketing and regulation of psychoactive substances, whether they are so-called legal or illegal, as well as cultural and social values and epidemiological and environmental conditions. So an obvious example here of something that might fit into this part of the framework would be decriminalization that we're seeing in BC. But it's also other indirect factors that Thea mentioned earlier, such as COVID and the associated public health measures and the impact that that had on the health of folks who use drugs, as well as factors like cannabis legalization, how cannabis is distributed, policies that guide the delivery of health services within communities, family policing or child welfare, as well as societal views on substance use. And you can see here the connections between the socio-political context and the processes that I spoke about on the last slide. Societal views on substance use are going to drive stigmatization, which was part of a process that we see that influences health. So those social and political processes operate across the framework and they increase health inequities. They can be driven by the factors that we see in the structural determinants. When we spoke about the socio-political context and what's important to keep in mind in our monitoring framework, what we heard from folks was, for instance, is there a gender lens routinely applied to policy, or an Indigenous lens, or a decolonizing lens that's applied to policies? Like, you could actually monitor that, I think, and say, is that a part of what any government is doing? This one's really interesting because it highlights gender within the policy development process. So over and above any evidence that we have on gender differences in health or gender differences in access to substance use services, for instance, is gender taken into account at the start, right from the start when policies are being developed? Can we monitor that? Second, I would like to see a monitoring tool on the development of decriminalization legislation going forward. How is that impacting? How is it helping? What kind of relief is that bringing for the person who has experience or who lives in vulnerable or highly at risk for being criminalized? Here, an implicit connection is being drawn between decriminalization, which is a policy intervention, and downstream impacts on people's health and wellness. So it emphasizes the need to capture impacts for so-called, so in quotes, at-risk communities, to focus on those who are going to be most affected by policy intervention. And that's part of equity-oriented monitoring, is shedding light on that part. The middle box, which highlights factors associated with people's social position, substance use, personal and material circumstances, as well as the system, services, and responses that are set up. These can be thought of as having two main components, really, that they break down into. The characteristics of people, so the identities that they hold that intersect to shape their health in different ways, as well as their knowledge, their behaviors, their actions, their attitudes. And second, the systems, services, and other responses that are in place to support those people. So this would include measures, for instance, of service use and the quality of services, whether they're appropriate, whether there are discriminatory practices, etc. These intermediary factors do not exist in a vacuum. They don't simply appear. They are shaped by the socio-political context, which we reviewed a moment ago. So the impact of holding a particular gender identity or racial identity, socioeconomic position, and so on isn't essential. It doesn't have essential impacts. It depends on the contexts that are there to support or constrain people's accesses to resources that they need for their health. And these contexts can vary over geography and time, which is why it's important to monitor them, to see what's happening there. Likewise, what you know, so your knowledge around substance use, and how you critically evaluate your own relationship to substances, what services you can access, what services you choose to use, are also shaped by the socio-political context, including drug policies, health policies, and so on. The double-headed arrows, see, you notice that these boxes are joined by arrows, so they're indicating that the boxes influence one another. The factors within these boxes influence one another. The services and responses in a population will depend on indicators of substance use in people's personal and material circumstances, and vice versa. Some of the quotes that we heard here related to this part of the framework are related to social position. Go back and you'll see a lot of it. So harms around substance use is around housing, or it's around poverty or socioeconomic status. If there's a way to really evaluate, monitor that, that's a priority that we heard during our groups. Or maybe it's like self-assessment tools with people who use drugs to get a picture of where they're at on that continuum, how they see themselves, and then how they're accessing services. People who use drugs have really been organizing and really advocating for themselves. Call it a counter story where it doesn't fit with what or how we've been studying and looking at harms. This one's really important. One of the reasons that we included responses in addition to what we think of when we think of formal health and social systems and services that are set up for people is that there is a lot of really good community organizing that is happening that then directs what's in place to support a given community. And so we wanted to capture drug user organizing as well as part of the monitoring framework. And finally, health outcomes related to substance use. So as Thea alluded to, one of the big pieces that we've heard about in the focus groups was the importance of looking at both harms and benefits. So not just focusing in on substance-related harms. Health outcomes, as we've defined them here for a framework, include self-rated health status and quality of life, self-reported benefits and harms, substance-related morbidity, which just means basically disease states, and mortality from administrative health databases. So yes, we need to know levels of illicit or apparent toxicity or overdose events. We need to know that for planning and for shaping our responses. We know that, but we don't just need to know that. We need to know a little bit more. I'll highlight here that in terms of getting a full picture of what health and wellness looks like within a population, we need both self-reported measures, so we need to hear from communities themselves, as well as tracking those routinely collected data that form part of our administrative health databases in Canada. What we heard from people, our participants in our focus groups, include when looking at health outcomes, add in the benefits in substance use outcomes, or substance use harms and benefits, or even put benefits before harms, right? There are reasons that people use drugs. Drugs actually kind of help people, keep people alive in a lot of instances. Sometimes the way we look at equity is very deficit focused. And so it tends to stigmatize or more often victimize people who are talking about substances. Are there ways to also look at positive outcomes, not just some of the ways that people are experiencing marginalization and oppression? Here, we again see that connection to the social and political processes, these dynamic arrows in the framework. There are processes that promote health equity. We want to capture those types of processes and the outcomes that accrue as a result of those when we're looking at equity-oriented monitoring. Whew, got through it. Okay, so wrapping up, existing monitoring and surveillance in BC, Canada, and I'd add elsewhere, internationally, capture many components of substance use and health. That was very clear from our literature review. What we're adding here is ways to think about how an equity-oriented approach sheds light on where we could focus future efforts to develop indicators to monitor. And specifically, knowing more about that socio-political context is going to highlight targets for public health interventions. Many of you who are familiar with public health programming know that when we're developing interventions to operate at public health, to operate through public health, the focus isn't an individual clinical encounter that we're looking to influence. We're looking to influence broader population health outcomes and health equity. Yet, we're often not monitoring those programs or evaluating those types of policy interventions like decriminalization, like cannabis legalization, in a way that takes into account these contextual factors that indirectly influence people's health. While there were participants in our focus groups who do identify as Indigenous, I want to acknowledge this was not an Indigenous-led process. Here, I'd like to acknowledge the really great work that's being done by one of our collaborators, Dr. Sana Sharam, Gwen Phillips, and Sophie Pierre from the Taha Nation, and the Mothering CoLab team, which is exploring equity-oriented monitoring specifically around perinatal substance use and health. And we acknowledge the need for this ongoing work, particularly around health equity and substance use, and the need for Indigenous-led processes specifically. So what's next? We're developing some bulletin type products that are plain language, contain graphics, and we'll share some of the findings that I just went over. And in addition, we're preparing an academic publication that goes more in depth into what the evidence says from previous literature and where we landed, and providing a rationale for what this work can do going forward. But I also want to give out a shout out to some work that we are doing as we're launching this framework. We've taken, as Thea noted, that our intent when we started this project wasn't to create a set of specific indicators. It was to create the overall framework that would highlight, for instance, what data do we have? What data do we not have? How might we want to shape our future data systems to be able to get at some of these equity indicators? And so we did get started, though, because we're researchers. We want to try out the product that we created. So we are doing a kind of like a pilot study that puts this framework into use. We developed a small suite of indicators that really focus in on equity within policies around unregulated drug use, and specifically unregulated drug use supply type measures that look at the policy context that is shaping people's outcomes. We selected and defined a small suite of indicators. We collected and we've analyzed that data. And over the next 2 months, we are going to be hosting what we're calling community dialogue events throughout the interior region of British Columbia and the island region of Vancouver Island, in order to speak with community about these indicators of sociopolitical context and outcomes within each community. So they're community tailored reports that talk about what's available in your community that is shaping responses to that are affecting people who use drugs. And we'll host those dialogue events and then prepare a bit of a report on our process and how it worked, so we can use it to refine it over time and share it with others so that they can also learn from this type of effort and how it might help with their advocacy work, with their community work, with understanding equity. And that's it for me. You have my email address here, as well as Bernie's, if you'd like to get in touch to speak with us about anything. I know we have a poll, don't we, Brittany, which will launch before we end, because we want to hear from people about what you thought about this session, and that helps us to report back to our funders at Health Canada about what it is that we're doing. But I'd also blew through that as quickly as I could so that we could leave a little bit of time for questions. We'll open it up now.
That's great. Thank you so much, Karen. And I really appreciate you being so thorough, but also quick. That was like, it went so quickly. Yeah, so I'll turn off the recording so we can have some like more thoughtful discussion as well.